So we are now in the second to the last video regarding the treatment of inmates with special needs under the PGMP manual. So we have here the topics on senior citizen inmates, on how we are going to deal with senior citizen inmates. So first is senior citizen inmates should be segregated and close supervised to protect them from maltreatment and other forms of abuse by the other inmates. Another is the individual case management strategies should be developed and adapted to respond to the special needs of elderly inmates since mm, senior citizens have different sickness, or some are dealing with the other challenges, and so special needs or respond unto them should be adopted by the management or from the jail. And another is collaboration with the other government agencies and community-based senior citizen organizations should be done to ensure that the services due the senior citizen inmates are provided. And lastly is that senior citizens or the senior citizen inmates should be made to do tasks deemed fit and appropriate with their age, with their capability, and with their physical conditions. So those are to be considered when they are given, or they are to be given a task to be accomplished. It must be inappropriate or fit to their age and their capability, yung kakayahan nila, and then the physical condition. Baka mamaya paugod-ugod na yung senior citizen, bigyan mo pa siya ng task na hindi niya kaya. So those are the guidelines when dealing with senior citizen inmates. We also have here infirm inmates. How about if we say infirm? If we say infirm, these are weak, or in short, weak, or the other meaning is weak. So if in case you are dealing with infirm inmates, and usually infirm inmates are caused by disease, or maybe also by old aged, yung mga ganun, no? So actually, infirm inmates and senior citizens are closely related, but sometimes infirm inmates are usually caused by sickness or contagious diseases. So, if you're handling infirm inmates, the manual stated that inmates with contagious disease must be segregated to prevent the spread of said contagious disease. Example is the present situation wherein the COVID-19. So if in case the inmate is positive with COVID-19 case, then they are to be separated so that they will not uh, uh, spread the contagious disease. Another also is the tuberculosis. So if in case the doctor had found out that the inmate has tuberculosis, then they will also segregate the inmate who has that disease. Another is the infirm inmates should be referred to the jail physician or nurse for evaluation and the management. So, if in case the infirm inmates, they are usually referred to the jail physician or nurse for evaluation. So, time to time, they are being checked by the jail physician. Another is infirm inmates must be closely monitored and provided with appropriate medication and utmost care. So that's why jail physicians or nurses usually check them from time to time for monitoring and to provide the appropriate medication. So aside from the infirm inmates, we also have here pregnant inmates or female inmates with infants. Inmates sana yun. So if in case you are dealing with pregnant inmates, they must be referred to jail physician or nurse for prenatal examination. They are should be given also the tasks that are deemed fit and proper and appropriate with their physical limitations. So they are given the task but those are light tasks, no? Hindi pwede yung mga outside tasks sa kanila. And during active labor, pregnant inmates should be transferred to the nearest government hospital. So they are to be referred to the nearest government hospital. And the treatment of mother and her infant shall be in accordance with the BJMP policy. So, on the BJMP policy for the treatment of mother and her infants is the infant will stay to the mother for the period of 1 month. So, for the next or the succeeding months, it shall be given to his relatives who has the capacity to feed the child or who has the capacity to take good care of the child. And female inmates with infants shall be provided with ample time or ample privacy during the breastfeeding activity. So, those are the guidelines regarding the pregnant inmates. Aside from the pregnant inmates, we also have here what if there are inmates with other nationalities like Chinese, mga ganun. So if in case they're dealing with inmates who are from the other countries, then the warden shall report in writing to the Bureau of Immigration and the respective embassies of the detained foreigner with the following information: the name of jail, the name of the foreigner, and the nationality and the number of his or her alien certificate of registration, if in case there is, and the age and the sex of the sex or the gender of the inmates. Aside from that is it also includes the offense charged, the case number, the court or branch of the court that convicted the inmate, the status of the case, and other information or additional data to be informed. So those are the guidelines or what to do if in case you're dealing with the other nationalities as an inmate. So that's all with regards to the inmates of the other nationalities, the pregnants, and infirm inmates, and also with the senior citizens. If in case you have any questions or queries regarding the discussion, kindly utilize our chat box or our group chat.